Hey guys, this is Dr. Hub. Today we'll be comparing the heparin as well as the LMWH, that is low molecular weight heparin, as well as the Fondaparinux. So let's start off with the heparin. The heparin, the structure is, so we're looking at the unfractionized heparin. So this is a glycose aminoglycans consisting of, so glycose aminoglycans. So what does it contain? So it consists of the long saccharide chains. So it has presence of the long saccharide chains. Next we look at the factor XA inhibition, the factor 10A inhibition. So under the factor 10A inhibition, is it present? The answer is yes. Then we move on to the factor 2A inhibition, the factor 2A inhibition. So under factor 2A inhibition, the answer is again yes. So that is the 10A is equal to the 2A. So the long chains act. So the long chains act on 10A and 2A equally. Next we move on to the bioavailability. So under the bioavailability, there is a oral and it is not absorbed. It is oral and it is not absorbed. So if you look at SC, that is a subcutaneous, it is not good. So why is it not good? Because of the presence of the longer chains. Because of the longer chains, it is not good. Then we move on to IV. In terms of IV, it is good. Then let's look at the variable response. So in terms of the variable response, the answer is yes. And how is the metabolism? Metabolism, it is cleared by the reticular endothelial system. This is written as RES. So how is the safety? The safety in terms of the renal disease. The safety in the renal disease is that it is very safe. So the answer is it is safe in terms of the renal impairment. Next we move on to the monitoring. So in terms of the monitoring, it is required. So it is required, and this is with the APTT. It is required with the APTT. Then comes the presence of the protamine sulfate as antidote. So how is the protamine sulfate as antidote? So here there is a full reversal. There is a full reversal. Next we move on to the risk of the heparin induced. Next we look at the risk of the heparin induced thrombocytopenia. So the risk of the heparin induced thrombocytopenia, the answer is it is high. And how is the risk of osteoporosis? This is going to be occasional. Next, we move on to the LMWH. So what is LMWH? LMWH stands for the low molecular weight heparin. It is LMWH. It's a low molecular weight heparin. So how is the structure? The structure is, it is a glycose aminoglycan. It is a glycose aminoglycan, and it consists of this short saccharide chains, and it contains the short saccharide chains. Then how is the factor XA inhibition? So commenting on the factor 10A inhibition, the answer is yes. And how about the factor 2A? The factor 2A inhibition is yes, that is the 10A is greater than the 2A. So the LMWH, it contains a mixture of the long and short. So in the unfractionalized heparin, it was 10A is equal to 2A, but that's here in LMWH, it contains a mixture of both long and short chains. So due to this, the XA is greater than the 2A. Next, looking at the bioavailability. The bioavailability in oral, it is not absorbed. It is not absorbed, whereas in case of subcutaneous, it is considered good. Next, let's look at the variable response. So does it have a variable response? The answer here is no. Next, looking at the metabolism, it is cleared by the kidneys. So it is cleared by the kidneys. Next, we move on to the safety in renal diseases. Safety in renal diseases. So the answer here is it is used with close monitoring. It is used with the close monitoring. And how is the monitoring? The monitoring is that it is required only in the renal impairment. So it is required in the renal impairment and with the anti-factor 10A assay. With anti-factor 10A assay. Next, we look at the protamine sulfate as antidote. The protamine sulfate as an antidote. So here there is a partial reversal, whereas in terms of the unfractionalized heparin there was a full reversal. Here it is a partial reversal. So it acts only on the longer chains. Next, in terms of the risk of the heparin induced thrombocytopenia. So this is going to be lower. And how is the risk of the osteoporosis? So osteoporosis is again, it is going to be lower. Lastly, we are going to look at the Fondaparinux. So in terms of the Fondaparinux, so how is the structure? The structure of Fondaparinux, it is a synthetic pentasaccharide. It is a synthetic pentasaccharide. Next, how is the factor XA inhibitor? The factor XA inhibition. The factor XA inhibition, the answer is yes. And what about the factor 2A inhibition? The factor 2A inhibition, the answer is no. The pentasaccharide has no function on the factor 2A. So there is no relation with the factor 2A. Next, we move on to the bioavailability. So in the bioavailability, there is oral. So oral is not absorbed, whereas the subcutaneous is very good. Subcutaneous is being very good. Next, we move on to the variable response. So how is the variable response? The variable response, the answer here is that it is no, there is no variable response. And how is the metabolism? The metabolism, it is cleared by the kidneys. It's cleared by the kidneys. Then how about the safety in the renal diseases? So safety in the renal diseases, the answer here is it is not, it is contraindicated in terms of the renal failure. And how is the monitoring? Should you monitor? The monitoring is not required. Then the protamine. Next, the protamine sulfate as antidote. So using the protamine sulfate as antidote, there is no reversal. There is no reversal. Next, we look at the risk of the heparin-induced thrombocytopenia. So how is the risk of the heparin-induced thrombocytopenia? So here the risk is going to be the least. And how is the risk of osteoporosis? Risk of the osteoporosis. This is going to be lower again.